Hi, I'm Dr. Srivatsa Lokeshwaran. I'm a lead consultant, interventional pulmonologist and lung transplant physician at Aster Whitefield Hospital, Bangalore. Today, let's talk about a very important topic. What's lung transplant? So, we have a lot of patients who have chronic ailments that affects their lungs significantly in such a way that the lung disease keeps progressing and it cannot be reversed back to normalcy. The patients also start depending on large amounts of oxygen to function their activities of daily living. So we usually offer these patients, a chance at life to come back to normalcy by removing or explanting the lungs that have already been destroyed by various processes. Now, who are these patients who usually require lung transplant? It can vary from diseases that scar the lung called pulmonary fibrosis or interstitial lung disease, or even patients with advanced airway disease like chronic asthma, chronic obstructive pulmonary disease because of smoking, etc. So there are a host of diseases that can cause a lot of damage to the lung if not taken due diligent care of in the initial period. Now, these patients not only require medicines to control the disease throughout their life, but also suffer from lack of limited activity, more or less chair-bound or bed-bound. Lung transplant provides them respite to come out of this very grave situation, to be able to carry out their daily activities without much dependence on oxygen, and also in some people to go back to their regular jobs and start having a normal social life which they intend to. So the usual donors in lung transplant, unlike other transplants, is a brain dead donor and who's kind enough to donate his or her organs to the various patients who require them. Before we acquire the lung of the donor, we make sure that there are certain tests done on the recipient as well as the donor, so that the donated lung matches not only the size of the cavity in which it is getting transplanted, but numerous other tests like blood grouping, cross matching, HLA typing, and so on and so forth. The science of lung transplant is very complex, but in simple words, it means that we are giving a new pair of lungs to the patient so that he is able to breathe normally, but will definitely be on medicines through his life to prevent the person from rejecting the lung that he has been transplanted, and also preventing infections. So this forms a vital role of a transplant physician to assist a patient who has undergone a transplant through his life to have a normal quality of life. So at Aster Whitefield Hospital, we have experience with lung transplants, and some of our patients who have had lung transplants in the past have been living a normal life on regular medications and are on routine follow-up. What has changed significantly for them is the way they perceive the world around them, not from being shut off into a room or to the chair, and are able to even go back to their job and have a very good life ahead. Thank you.